The positioning of a bandage is a full-fledged medical procedure that must be done with great precision. It must be stressed that a bandage that is badly positioned is ineffective and, even worse, dangerous. When positioned correctly, a Biflex number 16 or number 17 medium stretch bandage is highly effective and conforms to the newest recommendations of experts in the field. There are 4 categories of bandages: non-elastic bandage, short stretch elastic bandage less than 70%, medium stretch elastic bandage 70 to 140%, long stretch elastic bandage greater than 140%. The Biflex number 16 and number 17 bandages are in the medium stretch category. Experts have developed guidelines for a medium stretch bandage application technique that will result in optimal effectiveness and safety. The goal was to develop an application technique that would be simple, effective, and that would minimize undesirable side effects for the patient. A bandage is truly a medication. Like any other medication, the dosage, in this case, the pressure on the leg, should be neither too low nor too high. For example, the bandage can be applied too tightly. This can result in excessive pressure on the leg and, perhaps, damage to both the skin and the subdermal layers of tissue. Always check the reference mark and use it to ensure that the bandage has not been stretched too tightly. Whenever a bandage is to be applied, it is vital that the ankle brachial index be calculated in advance. This index is the ratio of ankle systolic pressure to brachial artery systolic pressure. A measurement of less than 0.9 or greater than 1.3 is a contraindication for the use of the bandage regardless of the degree of stretch. The method of effectively applying a Biflex number 16 reference bandage within 2 minutes is described below. It is preferable that a bandage 8 centimeters wide and 5 meters in length be used, as this size tends to fit easily in the hands of a woman. 4 basic rules must be observed. The bandage should begin at the base of the toes. Continue to wrap the bandage around the foot, moving toward the ankle and making certain that the heel is covered correctly. The next step is especially critical. From the lower leg to the knee, the bandage must be wrapped around the calf in a figure-8 manner each time, and each layer should offset the previous one by the width of a finger. While performing the previous technique, do not pull too much on the bandage. Position it with care. The reference mark should remain rectangular, therefore it should not be stretched into the shape of a square. Finally, be certain that the foot remains warm and free of pain in order to ensure the safety and comfort of the patient. In effect, this technique produces the equivalent of a multi-layered bandage. In the scenario described above, unwrapping the bandage would reveal 7 layers. Now, let us ask a nurse to apply the bandage. Make sure that you start at the base of the toes. You wrap the bandage around the heel as usual. Then, when you get to the ankle, you should begin to use the figure-8 wrapping technique. The rectangle on the bandage should keep its rectangular shape. Don't pull it too much. There, that's perfect. The width of 1 finger. No, I don't think that's right. It is here that we should measure the width of a finger. There you are. It's a tiny bit too long. It's too short. There it is, a finger width. Now it's just right. One must not forget that doing it in haste can result in errors. Thus, it is wise to take one's time in order not to forget any details of the procedure. In short, with respect to this technique, it is essential that the reference mark remain rectangular during the application of the bandage. It is just as essential to leave 1 centimeter between every 2 layers of bandage. Only a few minutes of training are needed for a nurse, a physician, or even a patient to learn this technique. The real merit of the figure-8 technique bandage lies in the amount of pressure it provides. Let us compare the results obtained from 3 different application techniques. First technique. We applied the bandage in such a manner that 50% of each layer was covered by the new one. The bandage was pulled until the reference mark was stretched into a square shape, and the squares were systematically half covered as we continued to wrap. Second technique. We stretched the bandage in the same way and then applied it in such a manner that 75% of each layer was covered by the subsequent one. The reference mark were thus completely covered. Third and last technique. We applied the bandage in a figure-8 technique manner as previously described. The reference marks remained rectangular in shape. The amount of pressure applied by each bandage was measured by the placing of sensors between the skin and the bandage. We refer to this measurement as the interface pressure. By using this technique, which is known as the Kikuim device, we took a series of pressure measurements at 2 locations along the leg, at a point designated as B1 and at another designated as C. This system allowed us to determine the specific pressure level of each type of bandage. During this procedure, we noted the amount of pressure both during rest and during muscle contraction. Both measurements were taken on patients in the supine position. The 3 techniques, then, while all acceptable, did not yield the same results. The figure-8 technique bandage, in fact, produced differences in pressure that were altogether remarkable. These differences in pressure are expressed as the static dorsiflexion stiffness index. When a patient is on a treadmill, differences in pressure observed with each step taken are even more important. We also know that a venous ulcer is always accompanied by an inflammatory edema surrounding the wound. The difference in pressure observed here reveals a massage effect that can decrease fluid retention in the subcutaneous tissue while the patient is walking. The Biflex has characteristics of both medium and short stretch compression bandages. The optimal overlapping of the figure-8 technique pattern ensures the bandage's stiffness. The results of the comparative study described above reflect the recommendations presented at various international consensus conferences on compression, as well as those of the French Haute Autorité de Santé in the treatment of venous ulcers. In order for compression therapy to be effective, levels of pressure that range from 30 to 40 mercury millimeters are necessary, and overlapping of the compression layers is highly recommended. The use of Biflex bandages is an effective, up-to-date therapy, particularly as the new classification system ranks them as medium-range stretch devices. When used correctly, Biflex bandages act like multi-layer bandages, and yet they can be applied much more quickly and easily. It should be noted as well that their use is not limited to venous-graduated compression. They also have many orthopedic and sports-related applications. Whatever their use, however, they should be applied with great care and precision. Their proper usage is what makes them so effective.